Hi, I'm Dr. Mallory Stuparich. I'm a gynecologic surgeon working at UCR Health. Here at UCR Health, we see a large proportion of our patients suffering from chronic pelvic pain, which may include endometriosis. Endometriosis is a disease process that affects anywhere between 6 to 10% of patients. And usually what happens in this disease process is that we can find tissue and cells that are similar to what lines the inside of the uterus in places outside of the uterus. So the prevalence of endometriosis in the general population is around 6 to 10%. That's probably underestimated because many patients who have pelvic pain may not get the full workup that they need to be able to get the diagnosis. Endometriosis is surgically diagnosed. That's the only way we can truly know who has it and who doesn't. Within patients who have infertility, around 20 to 50% of those patients may have endometriosis, kind of averaging out to around 38%. And then within patients that have chronic pelvic pain, around 70 to 90% of those patients may have endometriosis. So a typical patient who has endometriosis may have pelvic pain. They may also have difficulty conceiving a pregnancy, and so may actually have infertility as well. I think a lot of symptoms that patients suffer from when it relates to their menstrual period tend to get normalized in society a lot. So any individual who is suffering from debilitating pelvic pain, who has to call their relative to come get them from school, who can't go to work and has to miss days of work and loss of that income and the impact on their quality of life, deserves better care. They deserve better, and they deserve a physician that can help them navigate that. As far as management options, they usually include a combination of medicines and surgery is an option as well. The primary surgical management is typically a minimally invasive excision or cutting out of the endometriosis implants on the inside of the body. The beauty of the surgery is that it is minimally invasive, so most patients are actually being sent home on the same day. Depending upon how extensive the disease is can impact how long the surgery is, but in general, most patients require about a 2-week recovery time where they're just taking it easy. They may need off from work. They're not going to be doing any heavy lifting or any serious manual labor or exercising. The surgery in and of itself really specifically addresses endometriosis, but there is a whole host of things that can cause pelvic pain. I always like to talk about the fact that there are many systems that live in between the belly button and the top of the thighs, which is where a lot of patients experience chronic pelvic pain. And so we really need to have a holistic approach to handling or managing the pain that could be from any number of different sources in that area. So endometriosis, you can try to manage the symptoms, sometimes using hormones, sometimes using over-the-counter pain medications. The only, and I don't know if only is the best word, but the treatment that most directly treats endometriosis is the surgery, because we are physically going in, visualizing the implants, and then removing them from the body. I think that it's important because historically, communities of these individuals have been marginalized. It can be very difficult and overwhelming and sometimes even daunting for these patients to seek care. They may not have support, and so I want to be that physician that supports them on whatever phase of their journey that they may be on.